guys, it's Dr. Kelsey Camille from Premier Health Chiropractic in Coon Rapids.
I'm Dr. Brian Camille of Premier Health of Golden Valley. So today we're going to be teaching a little bit more of the muscle work that we've been sharing in our last couple of videos. So today we're going to cover the glutes. And the glutes are a really important muscle group because they're essentially acting like a natural back brace. Now, one thing that we have found with a lot of our patients when they come in, if they've had progressive low back pain for a period of time, a lot of them will go, hey, look, it's starting to come out of my low back, it's starting to creep into my glute region. And that's just because that tissue is doing a lot more work than it's supposed to. The cool thing is if you can do some simple stretching work to get it to move a little bit easier, what winds up happening is it acts a lot more like a natural back brace and it can actually support a lot more effectively. So, as I've said in all of our other videos, these are techniques that you can do at home. You can do these very simply with a partner. They're very simple to perform for the most part. Anytime that we are teaching muscle work, this is really useful stuff to integrate in just your regular life, because any kind of healthcare that you can get that's free, you want to do free things, and this is definitely one that you want to learn. So we do teach all of these things in our clinics. We teach once a month where we have all of our new patients and someone that's usually close to them come in, and we teach these kinds of techniques. It's a lot more hands-on. You do not have to be a patient in our practice to be involved in this. So if you would like to come in and you'd like to be a part of one of those evenings, just call our front desk staff. We'll have the information listed below the video to come in and then do some of that work with us. So we're going to go through the glutes. Now this one is a little bit tough because it's going to be a little bit difficult to see from the angle that we're working, but we'll explain as we go. So Dr. Kelsey, I'll have you lay face down pretty please. Thank you. Now, the good news is working with the glutes is pretty darn simple. So what we're looking for here is just some landmarks. So to start off with, we want to find the sacrum. Sacrum is that big triangle that's at the base of your spine, and Dr. Kelsey, that's right about here. Now, as we move off the sacrum, going towards the right leg, you can feel where we start to get into more of the dense tissue, the thick tissue, the booty tissue, and that's your glutes. And the glutes are very strong, they're very thick. Now, coming off again, that marker initially, we want to move out. We don't want to get all the way out to here though, because out here, if you press down a bit, you can actually feel bone. And that's actually part of your femur as it attaches up into the hip. We don't like to do muscle work on areas that are really close to bone, and the reason being is if we try to apply pressure here, essentially we're putting that tissue between a rock and a hard place, and we don't want to be doing that because it's super uncomfortable. So the glutes are a very easy area to work. So what I'm going to do is I'm just going to go right into the middle of that mass, and I'm going to use what's called a palm contact. So for me, as I do it here on the left-hand side, I either take my palm and I go directly into the tissue, or Dr. Kelsey will actually make a fist like this, and she can go directly into the tissue too. It's whichever one is more comfortable for you. For some folks, a palm contact is going to put a lot of pressure on the wrist. For other folks, if you do the fist and it's just that straight angle, that straight vector, it takes a lot of that pressure and evenly distributes it so it's not so much on your wrist. Now, how we do this muscle work is pretty darn easy. What we're going to do is we bring her leg up, and we want to keep it a little bit short of 90 degrees. For those of you that do have any kind of knee pain, knee replacements, things of that nature, be very careful with this. We don't want to bring it way up here, because if we do that, it's generally uncomfortable. If the knee feels uncomfortable as we're doing this, just drop it down a little bit towards the table. No problem at all. So how we do this contact is, again, I'm going to use my palm for this one. I go contact into the tissue, I just lean my body weight in. This is the laziest kind of muscle work you can do. Just lean your body weight into it. That's all the pressure we need. So, Kelsey likes to always describe this with her patients as if it hurts so good, we're in a great place. If it straight up hurts, we've gone too far. And if it just hurts, they're going to resist you anyways, no work gets done. So, hurts so good is fine, hurts, no. Now what we're going to do is we're just going to take that contact. For me, it's going to be palm. I'm going to lean into that glute. What I'm going to do is I'm going to take her ankle, and you can see out here, this is as far as it goes. We don't want to push past this. We just let her go through her natural range of motion. I put pressure on the glute. We bring it all the way across, and then when I start to feel a little bit of resistance, that's exactly as far as we need to go. We don't need to bring it too far out. We don't need to bring it too far in. We're just going to work within their natural range of motion. And what we're doing here is as I push this leg across, I can actually feel the glute actively being pulled underneath my hand, and this allows us to do a little bit of muscle stripping. It's a very effective way to pull the muscle underneath our contact point and just give it a little bit of a stretch. Feel that all the way through. How's that feel to you, Dr. Kelsey?
Wonderful.
Not bad. Excellent. So as we move through, generally speaking, when we're doing this, probably do about 10 passes. A pass is starting from all the way on one end of the range of motion, bringing it through the other. 10 is going to be plenty because you can even produce a little bit of soreness by doing just that amount. If you do get sore, it's not uncommon, particularly when tissue is tight. Icing is a big thing you can do with it. So if you want to use an ice cube, you can work that directly on the tissue for about 5 minutes till it goes cool, aching, burning, numb. When it's numb, you can stop. Or you can do an ice pack, about 20 minutes on, 20 minutes off. It's a very effective way to be doing it. So the more you can get the glute tissue to calm down, the better it's able to fire, the better it is at assisting the low back and the work that it does. Thank you so much, and I'll catch you in the next video.